No, don't stop him. Stop. You have to read. That is 5 minutes.
I stopped it.
Reset. Ready? Go. All right. You hear the tones going off. You're called for a 40-year-old male with chest pain. What are you going to do? If you ask firefighter Wilkie over here, he might give you a different answer. But you have to learn how to communicate with patients. That's the easiest thing, it's the hardest thing to learn to do is to communicate with the patient. There are 5 different groups of patients that we deal with. You have the pediatrics, adolescents, the adults, the geriatrics, and the special needs. Each one has a different difficulties, and you have to figure out how to talk to them. My name is Jeremy, and we're going to give you a couple of helpful hints today on what to do. So you start off with a pediatric patient. They can be broken down from 0 to puberty, basically. From 0 to 2, they're not going to be able to talk to you at all. They're going to rely on their parents, and you're going to rely on their parents, and ask them what's wrong with the patient to describe what's going on. The patient can't tell you what's going on, they can't point, they can't talk, they can't do anything. So you're heavily reliant on the parents for that. Ages 2 to 5, it gets a little bit easier. They're able to point out what hurts. They can tell you what hurts. We do have a smiley face deal. You can use a frowny face to a smiley face as this is good, that's bad. And that does help also. This age level, the kids are stranger aware. So having a parent with you or having them sit on their lap, hold their hand or have them right next to you helps out a lot. That keeps the parents more calm and it keeps the child more calm as well. One thing you want to really remember to do is get down to their level. I'm not saying talk down to them, but actually kneel down, crouch down, get so you can look them in the eye. You don't want to tower over the top of the person and stare down at them. That just doesn't work. 5 to puberty, that gets a little bit easier again. If they have something significantly wrong with them, or if they have a juvenile diabetes, they can tell you that. They can describe what's going on. They're becoming more independent, and they're a little bit better than the other ones. So the one thing you want to remember with all pediatric patients is to get down on their level, tell them what you're going to do, and don't lie, actually. If you're going to start an IV, tell them you're going to start an IV and it's going to hurt. Don't lie, say this won't hurt a bit, because then you lose all trust. The adolescence is from basically puberty to 17 years old. These are the most awkward ones to deal with, especially if the parents are around. They think they're independent, but they're not. The harder, or the worse the call, the more scared they get. We actually had a 16-year-old that got into an accident this year. He ended up breaking his ankle. His truck rolled over. He was fine, but as soon as he got on the phone with his mother, he just started crying. He saw the control. He was like, "Oh, Mom!" and told her everything that happened. It was actually kind of fun. But so with the awkwardness comes when you have to ask them the questions of if they smoke, do drugs, if they're sexually active. If their parents are standing right over by them or right by them, they're going to lie. They're not going to tell you the truth. So those questions are better asked in the back of the ambulance. The drug parts with adults, that'd be with police officers also. Get them in the back of the ambulance, give them their privacy, and that'll help things off and wrong. With the adolescents, you want to get down to their level as well. Talk to them, don't stand over the top of them, kneel down, crouch, and go from there. With this age level, you want to verbalize everything you're going to do. So if you're going to put patches on, say you're going to put patches up on your chest, on your sides. If you're going to do a physical exam, okay, I'm going to squeeze your arm, cut off your pants leg so you can look at your leg to see if it's broken and whatnot. You want to verbalize everything you're going to do so that you're not surprised. The adult patient is by far the easiest of them. They can tell you their history, they can tell you the medications they take, they can tell you their dosages. At this day and age, they'll tell you what they're taking, whether if they're smoking weed or doing whatever, they'll tell you. They're not going to lie to you. So that does help out quite a bit. And they can tell you their history. If you have diabetes, previous strokes, heart disease, family history, they're able to tell you all that stuff. So that makes it a whole lot easier. So once again, you want to verbalize everything you're going to do with the adult patients. It's not surprising. And talk to them at their level. So even if the person is unconscious, you don't want to verbalize everything you do because you don't know if they can hear you or not. So the geriatric patient, we'll say 75 to older, this can be challenging. At times they not only have more things wrong with them, but more systems can be involved. So they could have heart disease, or previous heart attacks, diabetes, COPD or emphysema. So not only do they have cardiac problems, they have respiratory problems, and they have renal problems. So it's multiple problems with multiple symptoms. So they also have significant medication list. So they can, that can be a challenge as well. The special needs population is probably the hardest one to do. If they're nonverbal, you don't know what's normal. So if they fall down and hit their head, they don't know what's going on, or you'll actually rely on the staff to tell you what's normal. You know, if they're sitting there bobbing up and down, if that's normal or not. If they're groaning, you don't know what's normal for them. So you actually have to talk to the staff and find out what's normal. With this group especially, you want to get down to their level so you're not intimidating. What you might think is normal can be very intimidating for some, so you just talk calmly, stay calmly, talk slower, unlike I'm doing right now. That is the hard group to deal with. So in conclusion today, each group has its own difficulties. We've dealt with pediatrics, adolescents, adults, geriatrics, and the special needs group. If you talk calmly to all of them, get down their level, you should be all right. Thank you for your time. Have a great day.